Hello, I'm Dr. Russell. I'm a GP at View Park Health Centre, but I'm also a qualified surgeon, and as such I do a lot of minor surgery work for the patients in the area, but also do it for the health board. In fact, I run the vasectomy service for Lanarkshire. Now, it's for that reason you'll be watching this. Almost certainly your GP has referred you to me, and I've asked you in a letter to look at this website or to get a DVD from me so that you can be well informed about this process, because it's important you know the details, both good and bad, and therefore you can make a wise decision as whether you want to have this done under local anaesthetic. It's rarely done under general anaesthetic these days because the local anaesthetic works perfectly well. The operation itself is exactly the same no matter what anaesthetic you use. However, just pay attention to this DVD for a short while to give you that information. But there's another thing I would ask you to do, and that's go on the practice website to follow up the links, and that way you can look at the information, either other forms of contraception or more details about the vasectomy, and you can double check on what I say by looking at other websites. So it's an easy way to enter into other links. Now, the first thing I'm going to tell you, quite simply, to get rid of some of the myths that you'll have heard. Your mates, your friends, your relatives might be winding you up, and they'll tell you you're going to get jag into the testicle and you hit the roof, which is not true. The other thing they'll tell you is that you're going to get a very big swollen scrotum, and you're going to walk away from the operation with a wheelbarrow or waddle down the street, which is also not true. So let's deal with those two things first, and I'll enter into the other details later. First of all, the injections. This is just like getting an injection that you would have at the dentist to localize the anesthesia in your gums. In fact, many of the fellows say it's not as sore as that because the skin in which I put the injection is soft and it stretches easily, and it's more like getting a vaccination in your arm, and there's a nip and a tingle as it goes in. Now, I'll show you where these injections are going to go anyway, just immediately prior to the operation, just to alleviate your worries about that. Second thing about the swelling. Now, it's true that after this particular operation there is likely to have some swelling. It's very, very rarely ever going to be a large swelling. Most men do get some swelling, and that's to do with the way we're made and to do with our anatomy, because during the operation there's lots of veins in the vicinity. Although I check that those veins are blocked off and they're not leaking, they can ooze after the operation for a day or two, and it's the oozing that causes the bruising and the slight swelling. There are easy ways of dealing with it. The first thing to do is use ice packs, just like any footballer does with bruising. Put a dish towel or a face cloth on the skin, and then put an ice pack on for 10 minutes at a time, and you can repeat that 2, 3, 4 times a day, as often as you think it necessary to make it more comfortable. Also, wear supportive underwear. Now, I don't recommend boxers, they're not really very supportive at all. Use trunks or Y-fronts or jock straps, and in that way the scrotum's well supported, you're less likely to get swelling, and you'll be far more comfortable at the end of the day. Now then, there's some other things that are helpful to know. The swelling tends to occur in the first week, indeed the first day or two if at all. In the second week you might get another complication, which is a bit of a pest after the operation. This operation takes place in the dirtiest part of the body, so inevitably the infection rate is slightly higher than when you have an operation at the top half of the body. You only have a very small little wound in both sides of the scrotum, but you've got to check on that wound because there's a possibility of getting an infection in that wound. This, as I say, tends to be in the second week. Check the wound is not getting more tender, more swollen, more red, and that you're getting the shivers. Any of those kind of symptoms, and it may be that you're getting a wound infection after the operation. If that's your concern, then you just ring up your practice, ask for an appointment with the practice nurse or your own GP, and they will check you out and give you antibiotics if need be. Now, the infection rate at View Park Health Centre is not very high. It's varied from year to year, from 3% to 6%. In hospital, research papers show it can be up to 16%. So it's not a situation I'm unduly worried about. The other good news to tell you about it is that we do not know of any case of MRSA that's been contracted after the operation in our treatment group. So that's good news for you, and that'll alleviate some of your worry about having any kind of operation at all. Now, there's one or two other technical little problems that may happen after the operation that you would like to know about, more to alleviate your worries than anything else. After I've done the operation, I put a little stitch in the little tube called the vas deferens that I'm going to tie off. It's why we call it a vasectomy. That little stitch around the little white tube can cause a little reaction of tissue, healing tissue, round it. And so you might feel a little bit of a lump and bump under the skin after the operation. Now, don't get unduly worried about that, because my experience over many years now is that that little lumpiness goes away in the fullness of time. It might take a week or two or a month or two. It's only once that I've ever had to take out that little lump over the years. So it's a rare event, and it's really to reassure you that you wait patiently, that lumpiness will go. A second type of lumpiness may be caused by the sperm trying to escape out of the blocked tube. It's called a spermatocele. Again, the best plan is just to wait and be patient, because that nearly always settles down and goes away. But once again, if it's a pest, it's not difficult for us to take it out under a local anaesthetic, and that's the end of that lump. There's a third lumpiness that can happen, and that is a swelling around the testicle. The testicle lives in a little sac that allows it to move around a bit comfortably without any pain. After any operation down in the scrotum, you may get fluid collecting round the testicle. Now, that fluid is called a hydrocele. It's just clear fluid, it's not infected at all, and it's very easy to deal with. It either can be allowed to go away on its own, which may take a week or two. It may be easier just to put a needle in and suck the fluid out, and that gets rid of it. Exceedingly rarely you might need an operation, because hydrocele is caused by other things as well. That operation takes away the fluid. In my own experience, I've only ever seen one case of hydrocele after vasectomy. There is a further complication you need to be aware of, and this is the category of being a real pest. Although it's very, very rare, it can be a nuisance to the patient. And this is a throbbing pain that comes on after the operation. Not immediately after the operation, sometimes a week or two, sometimes a month or two, but it throbs away and can be, for some patients, quite disturbing. Painkillers, of course, are the first line of treatment. Very rarely I've heard that some surgeons do operations to try and cut down the feeling that's throbbing away there. But my own experience is that we may have had one case over the many years I've done it, but I can't be certain of that case either. It's not caused by an infection. We're not quite sure what the causes are, but it's possibly, like many other situations after other operations, a little fibre of nerve that's been irritated, twisted, annoyed in some way, and so it throbs away. So it's not a gross complication in terms of the technique, but it is a pest for the patient if it happens. Now then, this is not a complication for you, and that is all to do with the hormones. You as a man continue to produce the same hormones you produced before the operation as after the operation. I'm not going to go near the way those hormones are made. I'm just doing a little plumbing job in the small tube called the vas deferens. The hormones are made in the testicle itself. So you as a man will continue to need to shave, you will still have your sexual feelings, you will still have libido, you will still have erections, just the same as before. If any of that changes, it's not to do with the operation, it's got to do with other medical or emotional situations, and if it's troublesome to you, then you need to see your GP to get some help and advice and investigations carried out if you need to. Now, a word of warning about the situation after the operation. You are still fertile for possibly weeks, if not a month or two after the operation. Now, the reason is fairly simple. The sperm you've already made have moved from the testicle up the little tube that I'm going to be tying off, and they go and get stored near the prostate gland. Now, the prostate gland's a gland about that big at the base of the bladder, and there's a little couple of glands there that hold the sperm ready for ejection during sexual intercourse. The prostate will continue to produce secretions during intercourse till your dying day. But the sperm that have already got to that storage area near the prostate gland need to be used up. So the good news is, and you have to tell the wife this, sex as often as possible for the next few months until that storage is emptied. It's at that stage that we do some tests on the semen to see if indeed that's the case and all the sperm have been used up, and it's at that point I will write and tell you that you now no longer need to use other forms of contraception. Until that letter, you must use another form of contraception. Otherwise you'll be in for a few accidents that you don't expect, and that'll be your responsibility rather than mine.